We see a lot of patients in clinic who really are coming to us because they have concerns that they're noticing some changes in their memory. And many of them are particularly concerned because they have a family history and they're concerned. I saw this happen to my mother. I'm worried that this is happening to me. And they really come in asking the question, is this just normal aging, or is this something that I really need to be concerned about? A number of years ago, people used to refer to these people as the worried well. But what research has shown is that really, there are many changes associated with aging. The same way as we can still walk a mile, but maybe we don't walk that mile as fast as we used to 10 years ago or 20 years ago. We can still learn new things, we can still process information, but perhaps we do it a little bit differently than we did when we were younger. We know that there's a difference between when you're normal and when you have a diagnosis of something like Alzheimer's disease or dementia. We know that those changes don't occur overnight. We know that there's a transition stage, and that phrase mild cognitive impairment really was coined to describe that transition stage. It's what we describe as a risk factor. So that people who have mild cognitive impairment may be at increased risk, and they need to be monitored a little bit more carefully because there is a chance that they would go on to develop more significant problems. But we also know that there are some people who have mild cognitive impairment and they don't get worse. We really encourage people to be seen by their doctors when they have concerns, because even if you get a diagnosis of mild cognitive impairment, part of the evaluation is to really determine why. Is there something that could be causing those memory problems? And so being seen by your primary care physician, by a neurologist, by a psychiatrist is important, because perhaps you're on a medicine that could affect your memory and that you could easily be changed to a different medicine. Perhaps you're having some symptoms of mild depression. One of the symptoms of depression is difficulty with concentration. If you're not concentrating, you're not going to be able to remember. There are some other medical conditions. Some thyroid dysfunctions can cause memory problems, and those are things that are easily treatable. And so it's important to find out what it is exactly you're dealing with.